are you doing today?
Good.
My name is Courtney. I'm going to be your nurse. Can you verify your name and date of birth for me, please?
Zoe 4/10/21/98.
Perfect. So the provider has put in a few orders to have an assessment done. So I'm going to go ahead and get that taken care of today, okay?
Okay.
All right. I'm going to do your respiratory first. Okay. Right upper lobe. Left upper lobe. Left lower lobe. Right middle lobe. Right lower lobe. Left lower lobe. Left upper lobe. Right upper lobe. Right lower lobe. Left lower lobe. Have you had any difficulty breathing?
No.
Okay. Well, since you're a post-op patient, I'm going to give you an incentive spirometer. I need you to do this 10 times in an hour or every commercial if you're watching TV, and I'll need you to do it 3 to 4 times. So essentially what you do is you take a deep breath for 3 to 4 seconds. There's a little ball in there, and it'll move up to show you how well you're doing. So this is to help prevent pneumonia, okay? Also, we'll have you do a turn, deep breathe, and cough. And so I'll need you to do that every 2 hours while awake. And that just helps to clear the fluid in your lungs. Okay, all right? All right, so what I'll do next is a cardiac assessment. I'm just going to listen to your heart. Any chest pain?
No.
Okay. All right. Aortic, pulmonic, Purge point, tricuspid, and mitral. I'm just going to check your upper extremities for any swelling, any edema. Capillary refill, good. Refill, we'll do this side as well. I'm going to have you lean your head back a little bit for me and then turn to the side. Checking the carotid artery, no JVD. Okay, and so I'll just check your pulse in a few other areas. So this is brachial right here. This will be radial if we're going to check down here. I'm going to check your lower extremities for any swelling. Up here, check your feet. And this is the dorsalis. This is the posterior tibial. And then we'll check this thing over here. Checking for any edema. Posterior tibial, dorsalis. It's your femoral right here. Fetal. I think that's it for cardiac assessment. Okay, so what I'll do is I'll check your head next. So we're checking for symmetry. Everything looks even. I'm going to touch your head if that's okay. Any tenderness?
No.
Okay, so there's no bones, no swelling, no abnormal, anything up there. So that looks good. What I'm going to do next is I'm going to check your hearing. Any chronic ear infections?
No.
No? Okay. All right, so if you don't mind, I'm going to have you plug your left ear, and I'm just going to whisper something. Let me know if you can hear it, okay?
Yeah.
Okay, can you plug your other ear for me?
Yes.
And I'm going to take a look at you. Your ears look symmetrical. They're lined up with the campus, so that looks good. All right. Do you mind taking glasses off for me? I'm going to check your eyes. Have you noticed any changes in your vision?
No.
Okay. I'm just going to have you look straight ahead for me, okay? Look straight ahead. Okay, don't turn your head. Just look at this with your eyes. And then look right here for me. Okay, all right. You can put your glasses back on now. All right, so your pupils were round, clear, equal, reactive to light. Your accommodation was good. I want to check your nose next. Okay, so I'm just going to take another look at you. If you don't mind lifting your head up, I'm checking your nostrils. Any congestion that you've noticed?
No.
Okay, so plug your left nostril with your finger for me and just breathe in. Perfect. We're going to do the same thing again. Perfect. And you didn't notice any congestion out of the blue there, did you? Okay, perfect. Okay, so what we're going to do is we're just going to check your mouth and your throat next. So if you don't mind opening up for me. Okay, great. All right, so your teeth looks good. Your buccal mucosa looks good. It's pink, it's moist. Your teeth look great. Your lips look nice and moisturized and even, so that's good as well. I'm going to pretend to give you a cup of water, and I just need you to swallow for me, okay? So here you go. And then go ahead and swallow. All right, any pain with that?
No.
Okay, I'm looking at your trachea. Trachea is midline like it's supposed to be, so that looks great. Everything looks symmetrical there. We're done with that, so we're going to do a neurological evaluation next. So do you know who the president is?
Yep, I know.
Perfect. You know where you are right now?
The library.
Okay, do you know why you're here?
Study session.
That's perfect. Okay, so if you were to have a brain injury, we would do a Glasgow coma assessment, and so it just checks for motor, eyes, and verbal responses just to make sure that you don't have any type of brain injuries and that you are fully conscious. But you answered everything correctly, so good there. And no history of any chronic headaches?
No.
Okay, perfect. All right, so we're going to do a musculoskeletal evaluation next. So I'm going to touch your elbow if that's okay. So I just need you to lift your arm up like you're flexing. Okay, and then straighten it out for extending. Okay, and so just hold your palm up like you're holding a can of soup. And then turn it over so your palm is facing the floor. Perfect. Okay, we're going to do the same thing over here. All right, so extend your arm. Okay, bring your arm down. Okay, and then holding your palm up like you're holding a can of soup. Supination. And then down, pronation. Okay, so I'm going to have you hold your arms up, and I just need you to push up against me. Okay, now push down. Perfect. So we're going to check your wrist next. So I'm going to hold your wrist. Okay, so if you don't mind lifting it up, flexing. Okay, and then just naturally let it down, extension, and then hyperextension. Wait, this is flexing, so that's flexion, sorry. And then let it relax, extension, and then lift it up, hyperextension. Okay, so we'll do circumduction. I'm just going to have you move it in a circle for me. That's perfect. We're going to do the same thing again. So down for flexion, lift it up and relax for extension, and then lift it all the way up for hyperextension. And then we're going to turn for circumduction. Okay, so also what we're going to do is going to have you turn it in for adduction and out for abduction. Perfect. And I'll do the same thing again over here. So turn in for adduction, out for abduction. Okay, so with your wrist, push up for me, and then push down. Okay, now I'm going to do the same thing with your knee. Okay, so flex your knee back. And push your knee out for extension. Okay. Oh, and hyperextension. Now, oh, your knee feels nice and healthy. No, nothing there. Alright, same thing again. So lift your knee back for flexion, and then let it relax for extension, and then lift it up for hyperextension. Nice and good. No popping or crackling or anything of the sort there. Feels great, nice and healthy. Okay, so we're going to do your ankle next. I'm going to hold on to it. Okay, so push your toes down towards the ground. So that's dorsiflexion. And then, oh, that's plantar flexion, like you're planting. So push your foot down for me. Dorsiflexion is up towards the sky. That was a normal sound. That sounded good. Nothing at all there. So turn your toes in, abduction, out, adduction. Great. And then circumduction, if you don't mind moving in a circle. Don't feel anything there. That's great. Nice and perfect. And then we'll do the same thing again on this side. So down, please. All right. So that is plantar flexion, and then up towards the ceiling. That's dorsiflexion. And if you don't mind turning your foot in a circle, so circumduction, that's good. And I'll have you turn your toes in, adduction, and out, abduction. Okay, so I'm going to have you put the outside of your foot like this for me. So that is inversion for both of them. Perfect. And then do it this way. That is eversion. And then what I'm going to do next, I'm just going to have you push up and push down for me. And then we're going to do the same thing right here. So just push up for me and then push back for me. Great. Do you have any limited range of motion that you're aware of? Okay, everything felt great. I'm going to have you stand up next. We're going to check your gait. All right. What I'll have you do next is I'm just going to have you take a few steps forward. And then a few steps back. Perfect. Okay. So I'm going to have you close your eyes. I'm going to put my hands around you so you are safe. And we're just checking for balance. Perfect. You can sit down. think that's it. Do you have any questions for me?
No.
The doctor will be in to see you shortly.